Okay, sounds good. So I just assume we proceed. Let's be mindful of everybody's time.
Works for me. Helen, you want to provide those?
Thank you, Council President Hurst. Appreciate your time as well. As you know from reading the newspaper that, or reading our website, that the city's cases did increase by 104 yesterday. That increase is due to some challenges as far as the reporting of tests over the weekend is concerned. That is the information that we've been given, that a spike happened in several cities and towns across the Commonwealth yesterday, but the results are based on the impact of the lag of reporting. We have been doing our own contact tracing. To date, we have done contact tracing for 680 individuals in the city of Springfield. We are going to consider, and I'm meeting with my internal team today, asking the Baker-Polito administration to allow us to use the portal that the state has put into practice. The reason for that is Springfield Public School nurses are not working with us this week because they are on vacation. This is their vacation period for Springfield Public Schools, and it's my understanding, based on their union contract, they are off this week, and so they cannot help us with contact tracing. So we will consider using the portal that the state has set up. We've not done that at this point, but that is something that we will consider. I'm asking the Baker-Polito administration to consider using the city's community-based health center, our 330 Health Center, for testing. As you're aware, the state has set up testing sites for 12 community health centers across the Commonwealth. None of them were in the Western region, as far as I could read in the advisories that have been sent out, not only by the Baker-Polito administration or EOHHS, but also what I can read based on the daily situational reports that are sent to us through the Commonwealth. So we are asking the Baker-Polito administration, and the mayor did call this morning, Governor Polito, to ask that our 330H Health Center, which is a federally qualified health center, be considered as a testing site for the Western region. The other thing that we have asked for is community-based organizations, it's my understanding, did get CARES funding to reach out to their constituents. We do not know who those community-based organizations are, but we would like to know so that we can encourage them to do their jobs and reach out to their constituents during this very difficult time, and make sure that we have the data we need around who is in need in neighborhoods across the city of Springfield. Again, I want to be clear, I do not know currently who those community-based organizations are, but again, it's my understanding those with federal contracts were given CARES money, and we'd like to know where that money is and who is getting additional resources to deal with the populations in the city of Springfield. Hopefully we'll know that soon. So that is really my update. I have received calls from some city councilors who are asking that I release neighborhood data on a more granular level. I do not have granular level data, but I have given zip codes so that individuals understand where the prevalence of the virus is in the city of Springfield. Obviously, that prevalence is in the neighborhoods that are dense, also those neighborhoods are inhabited, or the residents in those neighborhoods are individuals who appear to be low income, and based on our demographic data that we know already, are inhabited by communities of color and individuals who meet the poverty guidelines for the federal poverty guidelines. And so that's where we are at this point. We continue to work with our healthcare partners to try and do what we can to be supportive. But this is a time when we just need everybody to step up. I certainly am over 60, although I know I don't look it. Are you all? Hey, but anyway, so I certainly am in the high income. High income. I don't mean high income. That I'll leave that to Ed Pakula. He's in the high income bracket. But that group of individuals that people talk about at risk. When I came into City Hall today, I had my temperature taken. So there are things that we're putting in place, but I would ask that I think we do need a more targeted outreach in those neighborhoods that we see that are impacted. And I believe that there are community residents that have great reach in our communities that we are asking to get out and perhaps help us spread the word about the importance of adhering to the mitigation strategies that we've asked each of us to do, and to increase the personal responsibility that we each have to try to stem the tide of this virus. So I will leave that there and answer any questions that I can.
Are there any other updates from the administration before we move on, before we ask questions?
Yeah, Justin, I'd like to give us just a financial update. As of today, we have spent $4 million in the deficit spending account for the COVID response. That includes a lot of technology, laptops in the school department, custodial overtime, food service, and other related expenses. So we're tracking every bit of expense to match up the best funding source. The mayor has put me in charge of making sure that we are strategically using all the funding sources that are coming to us through federal entitlement grants. We're going to the state for additional resources when necessary, and then using FEMA as well to recoup any and all money that we're entitled to. We have lost $2.3 billion in revenue from the same period since the declaration by the mayor and the governor. That number continues to grow. And we were given some guidance from the state, the Mass Municipal Association, to plan on reducing unrestricted general government aid by 14 to 15%. That is approximately $5.6 to $5.8 million of a loss in revenue. So we'll be tracking all that. So the FY21 picture is muddy and blurry. We can't really make sense of it yet. The state hasn't issued guidance on how to properly move forward. What they're going to do in terms of the provide consensus revenue. I was on a call. I don't even know what date it is, but earlier this week, we got a call. We're on a call, and they said it could be as high as $6 billion lost at the state level. So they're definitely having their struggles, and we're looking at that. As you may have seen, municipalities and states were frozen out of the last round of stimulus funding. So we're hopeful that Chairman Richie Neal can help us in the next phase, because really what we need to address a lot of this is the loss of revenue. There is not a funding source that addresses loss of revenue. There's only funding sources to address the cost incurred with COVID-19 response. And so we're looking the next round, hoping that we can get some traction with the Congress and the President to help us out at a municipal level.
Thank you. Is that all?
That's it.
Okay, since we have a fairly intimate group with, it looks like only 3 counselors outside of myself on the phone call, I'll start off by asking the first question, since I usually don't get an opportunity to ask questions. And anybody there can answer it. I guess my frustration is, I always feel like, and I've heard the commissioner say it, that Western Mass is not getting their fair share of resources as it pertains to COVID-19. And oftentimes I hear the mayor, first it was the N95 masks, and then it was the testing kits for the homeless. And now it seems to be, what was the last thing that you mentioned, Helen? There was something that you mentioned today. Was it?
The health center testing at the community.
Yes, I was watching the governor yesterday, and every area that he had did not appear to be in Western Mass, and so I was perplexed. And so I guess my question is, why does Western Mass continue to get left out, and what can we do to help advocate on behalf of Western Mass? Why are we falling short, I guess is my question.
That's an excellent question. From my perspective, the geographical disparity continues to be an issue for us, and that is my opinion, and it appears to be factual. When I read the list of community health centers that we're going to have expanding tested, again, I saw nothing specifically for Western Massachusetts. I am not sure what the decision-making process is at the state level, and so I can't speak to that. I can only speak to what I'm reading and seeing, and again, no Western Mass health center was included in the list of health centers that we're going to have expanded testing.
And I guess I also, just as a follow-up, Tom, I feel like I don't hear us speaking out until it's too late, until like we were a month behind in terms of the homeless test kits. And so I also wonder, whether we're making some faux pas on our end, or we're just kind of waiting patiently, and maybe we shouldn't be doing that. But even with the homeless health kits, Boston had theirs a month earlier. And so, I wonder if we should start, making our voices heard a bit earlier, knowing that we might not be getting our fair share of resources. Tom, sorry.
That's okay. So what answer your first question is, one way to help is to advocate through the delegation. And it's something that we do, and the mayor's very vocal and keeping them in the loop. And they've been good. I gotta say, whether it's Senators Lesser or Welch or the entire delegation have been vocal. They've been doing a lot of work behind the scenes, keeping pressure on Health and Human Services and the administration to make sure we are getting things. So keeping the pressure on them is one way to do it. Certainly when the mayor has raised concerns and raised his voice, that they've been receptive. So just to keep that going, I guess, behind the scenes, or not so behind the scenes, letting the delegation know what our needs are, and impressing upon them that there are many needs, are many. That would be, I think, a good way to try to attack that.
Okay, thank you. So I will go in order, similar to how we normally do it, as more counselors get on the line, and I will start with Councilor Allen, followed by Councilor Gomez.
He's muted.
Councilor Allen, you're muted.
There we go. Sorry. I'm just going to follow on Councilor Hurst's comment there. We were with the state senators on Tuesday, and this didn't come up as a specific item that I remember, but I mean, it's a simple math in my view. Obviously, there would be some tweaks to this, but there's 6 million people in the state. There's 600,000 people in Western Mass. We should get at least 10% of everything. And those are the facts. Obviously, some of our population of Western Mass is more remote and in the country, and it's spread out a little more. And that might have a little impact on something, but at a minimum, there's 13 or 14 community health centers. 1.3 or thereabouts, or 1 or 2 should be in Western Mass. So have we tried that approach, kind of thing?
So I guess part of that argument is one that's probably about 200 years old. That Western Mass and working with State House for that long, that's really been the argument, that our voices aren't heard past 495 and all of that. So just to kind of impress that keep the pressure on the delegation, Tim, and keep talking to them, making sure that they're relaying our needs to the proper places, whether it's Mary Lou Sutters or the administration or MEMA or whoever, that they're hearing our voices and that they're responding. And I got to say that whenever the mayor's called NEMA or anybody else, it's been responsive. And so, like even this morning, called Lieutenant Governor Polito and said, "Hey, why weren't we a part of this this testing?" And Helen, that was going to be followed up with a call, and hopefully that's addressed today. But you're right, we shouldn't have to keep calling, but we are an afterthought. That's just the way it's been, and it's going to be forever.
I trust that you're doing it. I just I'm just trying to state the facts. That's all.
No, you're right. You're 100% right. All of you are.
Yep. Thank you.
Thank you, Councilor Allen. Councilor Gomez, followed by Councilor Letterman.
Thank you, Mr. President. Thank you, members of the administration that are on the call with us today. Thank you for your updates. More or less, my question obviously is particular to the resolution that I have filed. I wanted to know where the administration stood specific to vote by mail, and if we're going to go down that area, when can we start having that conversation? And just to have the conversation before, out of the 13 counselors, 12 of them have co-sponsored up to right now. We just want to have I know it's a resolution, it's non-binding, but essentially our two senators had stated that they're in favor of it. Moving forward, if we're still on lockdown, we don't know what the surge that's going on. 21 other mayors in the state of Massachusetts, in particular, to 3 of them, noteworthy ones are Will Reichel, David Narkowitz, and East Hampton's mayor also signed on to it. And there's a couple other more, but the whole point is if we're going to travel down this, I know that there was some federal conversation. I know the whole delegation is trying to fight for put a letter together, the whole federal delegation, leading by Congressman Kennedy. And I know that our Congressman Neal has adamantly signed on to it. Just if we've had that idea, has that conversation happened? And if so, when do you believe that we can start proactively having that conversation? I know that we're trying to get test kits. I don't want to sound redundant to Councilor Hurst and to my colleague, Councilor Allen. All of those things, I strongly stand with both of them that, we're definitely geographically I guess we're just feeling the rough right now from our constituents. And honestly, keeping them safe and practicing social distances on our own. I know that we're in a state of emergency. I want to know proactively how are we going to exercise our right to vote come September 1st and November 3rd. And that's just something that's just because I've been talking about it this week and it's in the conversation. I just want to know if the administration, if you guys aren't ready to talk about it, if that's an idea that we can talk about moving forward and, give some answers to some constituency aside from those other questions that my other colleagues had stated.
Gomez.
Adam, I did have reach out yesterday or the day before from Marty Walsh in Congressman Kennedy's office late in the day. I gave the information to the mayor. Honestly, we're in the middle of about 6 other things. He's got it. We haven't given it much thought or discussion yet, but I'm sure that we will as the next couple of days go by. And it is something that we probably can have talk and discussion about with you all in the coming days and weeks.
And I will meet with Election Commissioner Oyola so that the mayor is prepared to respond and with whatever information she can add to it, because clearly she's the one that is the expert in this area. And I want to make sure that we're complying with whatever guidance we're getting from DOJ, election, civil rights area, and make sure that we also interact with our state, with Secretary Galvin's office to make sure that we close the loop with everybody and not just take one part of it.
Right. Thank you for answering that. It's just, I know that we have a lot of things going on. I respectfully, completely understand that we have many, many things, and I know in a transition of this magnitude is going to cost money. And I know that our CAFO has stated that we have lost $2.5 million. But, just proactively, speaking, just so we can have the conversation and, just start trying to figure out, what are our next steps before it comes upon us in the month of July or August, and we're outside of the realm and outside of the conversation. So yes, talking to the state delegation is a must. And also, getting guidance from Secretary Galvin's office, because obviously, I not just for the city of Springfield, obviously I would love to see it abroad, but essentially if the city had to make a decision, if we were still going on through a peak or something like that, because I would hate for us to have the same things that happened in Milwaukee. It's just a scary thought, and that's what it is. I'll yield and I'll wait to ask another question. Thank you, guys.
Let me just add, Counselor, the Corona Relief Act had money in there for elections. So,
Right.
Right. That's why I want to coordinate with everyone to make sure that we're doing whatever we can to access the resources we need.
Absolutely. Thank you.
Followed by Councilor Whitfield.
Thank you, President Hurst. Oh, is it my turn?
Councilor Letterman first, followed by. Yeah. Sorry.
Good morning. I'll allow ladies first.
Thank you, Counselor. You're the best. So my question is for TJ. What I'm trying to figure out is how much of the COVID money is offsetting the 2.5 million that we're losing in revenue. I think like a week or two back, I had asked for a report or spreadsheet with the COVID funds that we received and what their specific uses are for. I know that we did approve some, but I would just like to see the full details of that money. And then I would ask President Hurst if he could, in the near future, set up a finance committee meeting to just go over where we are with all the finances as far as expenses and revenue.
So, Counselor, so the answer to your question is we are not allowed to plug any revenue gaps with any of the funding sources. We received a number of different funding announcements with very little guidance, with the exception of the HUD stuff. And HHS has got some stuff that they're going to be receiving some guidance on. We got a few other things. Right now, I'll send you the spreadsheet. It's about 4.4 million. We're just cleaning it up so it looks and it's easily readable. And I'll send that to you later today. And you'll see that there's about 4.4 million worth of money coming in that is to go towards the expenses related to COVID response.
Okay, thank you.
And TJ, why don't you send us everything that you can possibly send us that will help educate us on where the money is going to, and or if you could also include any of the grant funding as well, that would be great, and also what has been spent on to the extent you can. And what I'll do is I'll coordinate with Councilor Whitfield as well as TJ. We'll invite the rest of the councilors and certainly the finance team to be a part of it, but we'll schedule something next week to where we can take a deeper dive into the financial aspect of what is happening.
Thank you. Because we always talk about the revenue loss, but we also have a decrease in expenses. So I would like to see what decrease in expenses too, because that kind of offsets each other. So I would like to see that information.
Point well taken. Councilor Letterman.
Good morning. Thank you, Mr. Chairman. I want to start quickly by just echoing some of the sentiments that Councilor Gomez and Councilor Allen made, and I know the commissioners made relative to Western Massachusetts getting their fair share. Not only should we get our fair share, but I think there has to be a recognition that in the city of Springfield, we are more at risk than other parts of the Commonwealth. I know Councilor Whitfield has raised this before. Councilor Gomez yesterday was Earth Day, and a study came out from Germany that showed that a long-term exposure to air pollution leaves you 15% more likely to die from COVID-19. And so we know, because of the historical inequities that have existed, our city has been and continues to be more at risk because of exposure to air pollution and also other historical health inequities. So I think that point has to be raised, and I know we certainly will continue to raise it with the state delegation and the governor. Relative to health inequities and ensuring that our most vulnerable are cared for, I'm wondering if we can loop back to our conversation that we've had several times on this call about the response within the homeless population, and hoping we can receive an update from the commissioner. I know lots of work has been done with the triage tents. Wondering at this point how many individuals have been tested there and what those results might be looking like.
So currently, we know that there are 7 individuals who have been housed at the tent. We have not seen the numbers that we expected to see at this point, which is actually good news, that we have not seen an escalation in numbers. We have not begun the testing process at this point. I do not have those numbers to report to you. A part of the challenges is the healthcare workforce and some unionized issues that I understand we need to resolve before we can begin the mass testing.
So we haven't tested anybody within the homeless population at the tents yet?
We have tested individuals, but not the numbers that we need to scale up to. So we had wanted to yesterday, as you know, begin the process at the women's facility to test 30 to 35 individuals. We have not tested that cohort. Yes, we have had homeless individuals tested, but not in the numbers that we had anticipated at this point.
So who was tested, and what were the circumstances that they were tested under?
Individuals who had symptoms have been tested, but the asymptomatic population is really the population we wanted to get to understand just what the prevalence is in our homeless population. So we have been able to test individuals who have exhibited symptoms. They are in the PUI, persons under investigation, but the goal was really to test individuals who are asymptomatic so we can know what the penetration of COVID positive is in the homeless population. As you're aware, when they did the asymptomatic testing in Boston, or they tested 700 individuals, most of whom were asymptomatic, and they did find that there was a third of those individuals who were COVID positive, many of whom were not displaying symptoms. So our goal really was to be able to test the majority of the population so we could have a handle on those who are asymptomatic.
So when do we anticipate the asymptomatic testing beginning, and what will the timeline be what will the timeline be to see everybody at Friends of the Homeless tested, as well as the Springfield Taylor Street site?
Currently, we are working with Mercy Medical Center, who employs many of those individuals that we will use to do the testing. And right now, we are working with the administration to clear individuals to be able to help us with the testing. We will be able to work with the rescue mission they have asked us to test 30 individuals. I've been in contact with Ron Willoughby and also State Representative Carlos Gonzalez to be able to start assuring that we are going to begin that process next week.
Well, thank you, Commissioner. I know that I'm certainly out of time, but with the numbers that we've seen out of Boston of the asymptomatic population, I hope that we can see that process be completed as soon as possible.
You are absolutely correct, and that's our goal as well, Councilor Letterman, to make sure that we're penetrating that population so we can stop the spread.
Thank you.
Thank you. Councilor Fitton, followed by Councilor Davila. And I certainly have been lenient in terms of the questions and the time, just because we only have a few councilors on this call. So
You are an illustrious leader, Mr. Chairman.
Yeah, thank you. Okay, so two things. The first is just a point. I was at Big Y in West Springfield the other day, Helen, and they have signs everywhere saying that reusable bags are banned under the governor's executive order, and they've removed them from the shelves for sale. I was at Stop and Shop at the Springfield Plaza on Liberty Street, and they're still selling the bags. So, you know, I'm not offering any commentary on the wisdom of the governor's executive order to ban those bags, but I will just point out that in West Springfield, they have stopped selling them and have put up signs to that effect. And here in Springfield, not only are they still being used, but they're still being sold at the cash out registers. Just wanted you to be aware of that. The other thing, similar but a little different in terms of how Chicopee is handling things a little differently. I was at Walmart in Chicopee on Memorial Drive, and actually I was at the CVS down the street from my house on Broad Street as well. And both of those sites in Chicopee have aisles that are selling non-essential products roped off with a disclaimer saying that per the order of the Chicopee Board of Health, these aisles are not accessible to customers. You know, other facilities in Springfield don't have that same roping off of aisles. Stop and Shop was selling toys. I was at Ocean State Job Lot. I was able to buy a birthday card for my nephew, something I wasn't able to do at the CVS on Broad Street.
Do a lot of shopping.
I was
Yes. Okay, maybe that was over a 2-week period. I don't know. But okay, but the point is that is Springfield considering a similar action that Chicopee did to prohibit facilities that are open from selling non-essential products like birthday cards or toys?
So we have sent out advisories asking the stores or stores that are deemed essential to work with us around how they implement the governor's orders. But a direct no, we have not asked the stores in the city of Springfield, to the stores that are essential services stores, to rope off certain sections and not sell products that are deemed non-essential. The question becomes, when you look at products and you ask what is essential and what is not essential, we have heard from many of our residents that there are products that are deemed non-essential that are essential to their families. So we have not asked them to rope off certain sections. We certainly can do that, consider that. Then the question becomes around enforcement. It's my understanding that there is enforcement difficulty in those stores that have roped off certain sections, and that there are some concerns about roping off parts of stores and the store making a determination what's essential and what's non-essential. The third thing is, again, enforcement. Enforcing those, and that's why we haven't made masks mandatory. What we've asked city essential stores to do is to work with us and require individuals who go into their stores to wear masks. So the balancing act around enforcement and what we do is something that we've kind of kept at the forefront. So, but you're absolutely correct. Every municipality may have different structures around essential and non-essential products. And at this point, my staff is at all of those stores in the city. We have split our staff up into enforcement zones. And so we do have individuals who are going to Walmart on a daily basis to observe it, what's going on in the city of Springfield. Part of that is what had them really start to limit the participation in those stores to 40%. When Chicopee decided to rope off, it was in an environment where everyone was able to come into the store. Now stores should be only having 40% of their regular customers or their regular census coming into those stores. That has always also helped to decrease the foot traffic and hopefully keep down the number of individuals in the stores. And I'm struck that you shop a lot out of the city of Springfield, Council. You go to Chicopee, you go to West Springfield. Did you say anything about the store?
I'm surveying for public health, Commissioner.
Oh, okay, thank you. We appreciate this.
We've got the best practices.
May I recommend Mom and Rico's for your produce needs?
Councilor Davila, thank you, Councilor Finn.
Thank you, Mr. President. Good afternoon, everybody. Before I ask my questions, I want to piggy off quickly. Everybody hear me okay?
Yes.
Yeah, I'm going to piggy off quickly what Councilor Fento was saying. I personally, last week I went to Walmart on Boston Road, and although I hear that now we're going on a daily basis, at the time when I went, it was pretty much a free-for-all. And it was business as usual. I was deeply concerned with it. On the other hand, I have to give kudos to Aldi's on Boston Road. They have signs everywhere. They have tape encouraging people to keep 6 feet distance, and they're counting the people. They don't allow more than 50 people in. I thought that was pretty good, pretty proactive, and I just want to acknowledge that we have people, good people in the city, good business following the guidelines. So. Just on that issue.
Let me just address the Walmart. We have had them change their aisles so that you can only go one way up one aisle and the other. And we've asked them to do that. You know, I'll send someone back out there, but we really have tried to work with them because, you know, the population that goes to Springfield Walmart is really one that we want to make sure stays safe, number one. But number two, we certainly have asked them to change their aisle structure. They are promoting social distancing. So thank you for saying that. We do go there on a daily basis. We can't be there all day. But right. I just want you to know that we have tried to enforce the governor's edict standards.
Right. And I just have to say that I hope they do, and if they don't, I'm sure the city will take the appropriate steps as necessary. But going into my question, I am I'm very concerned with what's happening in the city. As you have stated, we're surging. I'm sure by now we have over 1,000 cases in the city. I did bring up the last time we met as a council the idea of home testing. I emailed you, haven't been able, you and I, to further discuss this issue. But I want to bring the idea of a home testing. Now, I do have to say that I am a little surprised that the mayor the administration puts out a press release saying that the home shelters are going to be doing testing. And then this morning, we get a news press saying that Springfield is not getting any test kits, at least as I read. I don't know where disconnect is, but I also find that concerning. And I do realize that we are living in unprecedented times, but we need to pay attention to the hotspots. It appears to me that according to the press release that the administration put out, they want to use that approach of the health centers. I do want to introduce the possibility of using home tests. Now, why is that? Because I think it's going to help us to be more direct to identify, isolate, and contain the virus. There's many issues with this population. The north end, Briarwood, Mason Square, even part of my district, for Spark, that are very challenging for many reasons. And so it's something that I would like to some point to further discuss with you. Offline is necessary, but I do believe that home testing, it's an approach worth looking at. Right now, I feel that it's pretty reactive, and we need to be pretty proactive.
Thank you.
Thank you. Are there any other questions?
I'm sorry, Mr. President. I just, besides thank you, is there anything else you guys could say at this point, or rather not?
As far as home testing is concerned,
Yes.
home testing currently is not widely available. There is, they are considering home testing for first responders, but if you look at the cost of a home test kit, it was something like over $100. So in order to do testing at home, I'm going to assume that the cost as they are mass produced is going to go down. But right now, home testing is a significant investment for a resident. And certainly you understand that could be cost prohibitive to many of the residents in the city of Springfield. And so home testing is not widely available. And there is a process to go through to use home testing. And again, I'm hopeful when it's mass marketed that the cost will come down. It'll be more readily available to individuals who may find that cost to be something that they cannot afford in their budget. And so that would be my answer to home testing at this point.
So if I may, Mr. President, so Commissioner, is the issue that the home test that is done at the hospitals or health centers, is that different than is at the home? Is the kit itself different?
I have not, Counselor, been informed that home testing is available in the Commonwealth of Massachusetts at all. And I'm seeing as I do the research around the country that home testing is not readily available to massive population. Home testing is an idea, is a product that is coming out of a company, but it is not widely available at this point. And I certainly have not understood it to be available in the Commonwealth of Massachusetts at this point.
Right.
I'm sorry, the baby on the line.
Right, I do. Right, I am not suggesting that we test every single home in the city of Springfield. That would be nearly impossible. But at the very least, that we those people that have been diagnosed with a positive COVID-19 case, that we follow up. We're doing already contact tracing, as I understand it from the state, that we test the loved ones of the people affected with the virus, again, in a way to mitigate the contact rate. Now, I understand the financial implications. We got to spend money. It's, otherwise I personally feel that we're going to be penny wise and pound foolish. We cannot get away from this, that is going to cost money. And so I just want to say that again, I know you guys are doing your best. I do believe we need to explore this avenue of home testing, particularly with the hotspots. And again, this is an issue that I would like to discuss with the administration accordingly offline later on as necessary.
Thank you, Councilor Davila. So we are now at 12:15. I see 2 hands raised, so hopefully the administration will indulge us for those final 2 hands, and then we will conclude this call. I see Councilor Whitfield as well as Councilor Gomez. After we entertain those questions, I see Councilor Allen. If we could just entertain 3 more questions, it'd be greatly appreciated by the administration.
We'll take it off next week's meeting.
Thank you, Mr. President. Mine is more of a comment directed at what Councilor Fenton was talking about as far as essential. I had my 5-year-old niece for 5 days, and it was essential for me to get to the store and get some coloring books and some toys and things like that, because I didn't know what to do with these children. I feel for you, everyone who has small kids at home every day, trying to work, trying to get things done. I said, whatever toy they have, we're buying it. We're buying every coloring book and every book they have, and she's just gonna do that stuff all day, because it was like 5 days. She had to go back home. But so we do need to just be mindful of what we consider essential in our hurts, because I feel for the parents who are dealing with this every day. I commend you so much. You are awesome.
Councilor Gomez, followed by Councilor Allen. And then if everybody's quick, then we'll bend the rules and get Councilor Letterman in. Sorry.
No problem. Thank you, Mr. President. And one, thank you, Tracy, because I'm one of those folks that got little foot over here that's jumping through the walls and stuff. So coloring books are essential, right? My more was I had a constituent that called me. You guys can hear me, right? I feel like I'm like muted or something. I don't. Okay. So I had a constituent call me because I know that City Hall is closed, and she was inquiring to me about procuring a document, which I think was her birth certificate, and if they would readily if the clerk's office was open, it would cost her $20. I guess we give the information to go online to pay for one, and you can get it online, but it costs 60, like triple the cost. And I know during these trying times, I know that some documents are necessary that we need to get to people, but I don't know if that's something that you guys can talk about, that through the online service or something. It's 75% more of the price, and she's an elderly woman, and some of these documents, sometimes when we go through a third party, they become a little bit more money, and I was kind of concerned about that, and that's all it was. And then
You get me the number. It's probably what she's ordering. She's probably ordering the long form as opposed to just the small little notice that she needs. Give me your number. We'll figure it out for her.
Yeah, it's constituent Sherry Subert from the Subert family. So I'll definitely get her the contact you.
Councilor Allen and Councilor Letterman. If we could just be really brief and mindful of their time, it'd be greatly appreciated.
Thank you. I just looked for the current population numbers, and they're not. This is not current. This was 22,000 or something off of Wikipedia. But we had 814,000 people in Western Mass out of 6.3 million, which is 12%, over 12% of the population. And our population is more remote. At that point, it was 293 people per square mile, whereas the state was 312, and the Eastern Mass was 422. So we're much more remote, which you could argue for needing more than 12% because people have farther to go. So that's just my facts to support the population thing.
Thank you, Councilor Allen. And I believe Jesse had to go, so Councilor Davila will allow you to make the final words, and then we're going to conclude.
Thank you, Mr. President. I feel honored to have the final word here. I just have a quick question. Going back to the hotspots, what kind of steps or to whom have you, the administration, reached out to community leaders, organizations within those hotspots to help mitigate the crisis? Or is this just a response, this is what we're doing and that's it? Or are you guys reaching out to accordingly to help mitigate this?
Thank you, Counselor. I really appreciate that question so much.
You're welcome.
You, as I've said, each of you have a role. You certainly represent the constituents across the city of Springfield and in your neighborhoods. So I'm hopeful that you will use the status that you have as a city councilor to reach out to individuals in your neighborhoods to reinforce the messages that we're sending as a city. The other thing that I said earlier, which I think is very important, there are agencies and organizations within the cities who I believe are getting funding to be able to do that outreach as well. What are we doing? Our staffs are on the phone. Number one, we do have the hotline, as you know. The hotline is staffed in many languages in the city, and so a resident can certainly call the hotline and get give information and get information. So that's an outreach tool. The other outreach tool that we're using is all of the organizations that our department worked with. We are working with to get those neighborhood-based messages out. Counselor, we can use all the help that we can get. I will tell you that this is an overwhelming task. The city and the country has never faced anything like this before. We understand that Black and brown people are mainly at risk based at demographics, underlying conditions, poverty levels, And so when I tell you that we can use all the help we can get, I ask everyone to engage in this with us and help us reach those hot spots and cool spots in the city to be able to get the message out around the mitigation efforts that we have continued to put out there. It's very disheartening for me to go through the city and see individuals gathered as if it's still an open society and we can do whatever we want. So I would ask all of you to engage with us as we try to do this. We can't do everything. I certainly know the limitations of the Department of Health and Human Services, and that's why I'm consistently asking for assistance. So join us.
Thank you, Commissioner. If I just may, Mr. President, close with this quick 10 seconds. I don't know if you just say join us, but I am part of the government and being here. And I know what I'm doing, at least on my end, and reaching out accordingly, Commissioner. This is a time for action. Again, I'm very worried, as we all are, and I do recognize that you need a medal after this. So I don't know if you just say join us or not, but just to be clear, I've been here. Thank you.
Thank you, everyone. I appreciate it. Thank you, Commissioner. Thank you, Solicitor, and thank you, TJ. You guys have a great day.
Thank you, everybody.
Have a
Thank
great
you.
day.
I'll see the councilors next Tuesday. We have currently 2 state representatives that have committed their time to see what it is that they are doing at the state level as well. I know a lot of these questions kind of related back to what is happening at the state level and how we're pressing for resources here in Western Mass. So hopefully they'll have some answers for us as well. You guys have a great day.